At age 70, your body has been through decades of experiences, good, bad, and everything in between. But did you know that some medical tests we've trusted for years may actually be unnecessary or even harmful after a certain age? Today I'm going to reveal 5 health checkups that seniors over 70 should think twice about. And trust me, some of them may surprise you. Welcome to Seniors Secrets, where we gently guide you toward healthier, happier golden years. If you're over 60 or care for someone who is, you're in the right place. Let's explore how less can sometimes be more, especially when it comes to your health after 70. Let's begin with a test many seniors have undergone, the colonoscopy. It's long been the gold standard for detecting colon cancer. But here's the surprising truth. After age 75, routine colonoscopies may do more harm than good. Take Mr. Thompson, a 76-year-old retired teacher. He went in for a routine colonoscopy. No symptoms, no issues, just following his doctor's checklist. But during the procedure, a complication led to a bowel perforation. He ended up spending 10 days in the hospital for something he never needed. According to the U.S. Preventive Services Task Force, routine colon cancer screening is not recommended past age 75 if there are no symptoms or family history. Why? Because the risk of sedation, bleeding, and infection increases, while the likelihood of benefit declines significantly. If you're over 70 with no history of polyps or symptoms, ask about non-invasive stool tests instead. They're safer and often just as effective. Now, gentlemen, this one might surprise you. The PSA blood test for prostate cancer has been part of routine checkups for years. But after age 70, the evidence becomes shaky. James, a 72-year-old grandfather, had a slightly elevated PSA score. It led to a biopsy, which led to a diagnosis, and eventually surgery. But guess what? His cancer was so slow-growing it likely never would have caused harm. According to the American Urological Association, PSA screening is not routinely recommended for men over 70, unless there are specific risk factors. Why? Because most prostate cancers at this age are so slow they never pose a real threat, yet the treatments can cause incontinence or erectile dysfunction. Focus instead on watchful waiting or active surveillance if PSA levels rise slightly. But avoid aggressive interventions unless absolutely necessary. Have you seen those ads for whole-body CT scans that promise to catch diseases early? Sounds reassuring, right? But these scans often cause more worry than wellness, especially for seniors. Eleanor, 74, paid out of pocket for a full-body scan she saw on a billboard. They found a suspicious spot on her lung. It turned out to be harmless scar tissue, but not before she went through a terrifying month of extra tests and hospital visits. Full-body scans expose you to high doses of radiation and frequently detect incidental findings, benign things that lead to unnecessary procedures. Stick with targeted scans when there's a clear symptom or family history. And always ask, will the result of this test change how we treat me? Ladies, this one may come as a relief. After age 65, if you've had normal pap smears for the last 10 years, you likely don't need cervical cancer screening anymore. Martha, 69, had a pap smear that came back slightly abnormal. She panicked, only to learn it was a lab error. She went through 2 painful biopsies before her doctor confirmed, "You didn't actually need this test anymore." The American Cancer Society recommends discontinuing cervical cancer screening after 65 if prior results were consistently normal. But if you've never been screened or had abnormal results in the past, talk to your doctor before stopping. Back pain is common as we age, but rushing into MRIs or X-rays for every ache and pain, that can lead to a dangerous spiral. Harold, 78, complained of mild lower back pain. His doctor ordered an MRI right away, which showed mild disc bulging, completely normal for his age. But this led to spinal injections, physical therapy he didn't need, and thousands in out-of-pocket costs. Most imaging for back pain doesn't change treatment unless there are red flags like severe weakness or weight loss. Imaging often shows abnormalities that are simply part of aging, not necessarily the cause of pain. Try physical therapy, stretching, and posture support before going down the imaging rabbit hole. Now let's be clear, health screenings can save lives when used thoughtfully. But after age 70, it's not about doing more tests, it's about doing the right ones. Let's quickly recap. Colonoscopy. Reconsider after 75 if no symptoms. PSA test. Avoid routine screening after 70. Full body scans, high radiation, often unnecessary. Pap smears may not be needed after 65 if prior tests were normal. Imaging for back pain, often unhelpful without serious symptoms. Instead of chasing every test, focus on your overall well-being. Eating well, moving gently, managing medications, and staying connected socially. Thank you for spending this time with us today. If this video helped you feel more informed and confident in your health journey, please give it a like and share it with a loved one who needs to hear this. Leave a comment below and let us know which checkup surprised you the most. And if you'd like more calm, clear, and caring health advice just for seniors, don't forget to subscribe to Golden Wealth. We're here for you every step of the way.